Hi, welcome everybody to our Too Hot to Work webinar. Bienvenidos a todos los que están aquí. Before we start, I just want to remind everybody that this presentation is being translated in Spanish. Esta presentación va a ser traducida en español. If you want the translation option, please refer to the bottom of your screen where it says more, por favor. Si quieren la traducción, escojan la opción más abajo en la pantalla para que puedan seleccionar la traducción. And once again, thank you for everybody for being here. This presentation, this webinar today is being brought to you by National Farmworker Ministry. We are a faith-based organization that supports and uplifts farm workers across the nation, farm worker organizations. And we are here to mobilize, educate, and equip the community to support and uplift farm workers. Today, we're going to be talking about heat stress, how it impacts farm workers across the country, why current protections fall short, and what we can do together to push forward meaningful change. So, as many of you know, farm workers are on the front lines of climate crisis, and temperatures are rising, and so are the risks that they're facing. We're going to talk today, break down some of those health realities of extreme heat, the ongoing advocacy behind the current legislations and policies, and the steps that you can take to keep those protections. Today, our presenters is me, myself, Elizabeth. I'm the Director of Farmworker Advocacy with the National Farmworker Ministry. We also have Alexis Guild. She's the Vice President, Strategy and Programs with Farmworker Justice. And we have Jeannie Economos with Farmworker Association. She leads the Pesticide Safety and Environmental Health Project coordinating. And then we also have Ernesto Archila. He's the Vice President of Strategy and Programs with Public Citizen. So what is heat stress? Heat stress occurs when the body cannot regulate its internal temperature. Prolonged exposure to extreme heat can cause serious illness, including but not limited to heat stroke, heat exhaustion, rhabdomyolysis, heat cramps, heat rashes. And I took this picture here. I added this picture because this is a picture that I snapped of farm workers that were harvesting okra near the Texas-Mexico border in mid-August. Temperatures reach a high. We've had a highs of over 100 degrees. This day was 96 degrees with a real feel of over 117 degrees. And I just wanted to show that example of how farm workers are protect themselves from the heat and from their environmental exposure to the elements. So the deadly reality of heat stress for farm workers, it's the leading cause of death among U.S. farm workers. They're paid by the quantity that they harvest, so that creates pressure for them to skip shades and water breaks. There's a 20 to 30% chance of a risk that they obtain of dying from heat stroke or getting any kind of heat illness compared to other workers. Most of farm workers are foreign born, and they do fear retaliation or job loss for leaving work early. There is no job security for them. They also have limited access to healthcare, and the fear of speaking out, leading to the underreporting of heat-related illnesses. Factors that increase heat risk and that make farm workers extremely vulnerable to heat stress is the fact that they are exposed to direct sun for long periods. It's high temperature and humidity. There's a lack of shade or airflow. They're wearing heavy or non-breathable clothing. Sometimes, a lot farm workers are under medications that might be affected by heat. There is also indoor radiation heat stress. For example, workers that work in greenhouses or work in packing sheds where there is little and poor ventilation. There's a lack of acclimation to hot conditions, dehydration, advanced age or pregnancy can also be a risk factor to heat stress. Any individual that might have a history of heat illness is already at a greater risk of heat stress. There's also pre-existing health conditions and a lack of workplace protections, as I mentioned, that many farm workers fear retaliation or losing their job if they do speak up, if they are feeling ill or do have to take a break. And so with that, we're going to remind everybody we have videos on our website. You can learn more by visiting our website or going to our YouTube page so that you can learn more about heat stress. And we're going to introduce now our next guest speaker. And that's going to be Jeannie Economos with Farmworker Association.
Hi. Good morning or good afternoon to everyone, wherever you are, East Coast or West. If you want to go ahead and pull the slides up, that would be great. I just wanted to say that the Farmworker Association of Florida is a 42-year-old grassroots farm worker organization, community-led, farm worker-led organization in Florida. You can go ahead and show the first slide. We are very unique among farm worker organizations in the country, as that we have you can go ahead and start the first slide.
Yes, give me
Yes,
just a
okay.
moment.
Okay, sorry.
There you go.
Yeah. And so we're a grassroots organization. We have 5 offices in the state of Florida. We're pretty unique among different farm worker organizations in that we do a lot of work around health and safety of farm workers, which over the years has mostly been around farm workers and exposure to pesticides. But in more recent years, especially with climate change and increased high temperatures, we have put more focus on heat stress. We also have determined that community-based research with academic institutions is really advantageous. We enter into partnerships with universities when we can do research that advances our advocacy for better health and safety for farm workers. You can go to the next slide, please. And we have been working with Emory University in Atlanta for over about 14 or 15 years. We started about 14 years ago when we realized that heat was becoming an increasing problem among farm workers. There was a phenomenon in Mesoamerica called chronic kidney disease of unknown origin. They were finding young men working in the fields and sugarcane and other kinds of crops in Mesoamerica that were dying from kidney disease, and they had no preconditioned factors such as diabetes or any other factors that would lead to them having kidney failure. And so it became quite a conundrum all around the world. People were wondering why these young men were dying of acute kidney disease. So there was a supposition that it might have been related to pesticide exposure, but they found out more that they thought it might have been related to chronic dehydration. So the objective of our study with Emory University was to look at chronic dehydration of farm workers and the effect on their kidneys and acute kidney injury. And so we started this project, it was called Los Girasoles, which means the sunflowers in Spanish. That's our symbol. And we started a project, where we looked at blood and urine samples over a 3-day period. And you can go to the next slide, please. And I'll tell you a little bit more about how that was, how we did that project. So first of all, we were looking at the effects of heat on farm workers related to several different things. First of all, their activities, and you can see the picture on the right. It's a gentleman harvesting oranges in the full sun. And you can imagine that's lifting heavy objects like a bag of oranges. So part of it, we looked at activities, the positions. You can see that graphic in the middle there of farm workers bending down. Then, of course, the environment, the full sun, and then the duration of time in that environment. So the Farmworker Association, like I mentioned, has 5 offices in the state, and they're all in different kinds of agricultural areas. So for example, in Pearson, it's mostly ferneries, and you'll see pictures of that later. In Apopka, we have mostly ornamental plant nurseries where workers work in greenhouses. And then we also in Immokalee have workers that work in field crops. Next slide, please. And so we looked at, I think it was over 250 workers in all three, in a total in all 3 of those areas. And we looked at the effect of how much heat affects different organs of the body. It really affects all your organs, but it especially affects the brain. It could lead to lower concentration, poor memory, and headache. That can be very dangerous if you're working in agriculture, especially around machinery or on ladders. It can affect your heart, and some of the symptoms are dizziness, fainting, fatigue, low blood pressure, and heart attack, which of course is very serious. And then it affects the kidneys, and it could cause acute kidney dysfunction, and it could cause chronic kidney disease. There are different levels of exposure to heat, starting from heat stress to heat syncope, all the way up to heat stroke and heat exhaustion and heat stroke. And of course, heat stroke can lead to death. Next slide, please. And so when we did this project, it was very exciting because we were using some really, at that time, really new technological equipment, which was really exciting. Today, it's all old now, even though it's only 10, 15 years ago. But we used this measurement here so that you see the little device up there in the right-hand corner. That device was to measure body temperature. And you'll see the picture on the low left. So that we would have the workers come in and they would swallow a pill. And the pill would, every 30 seconds throughout the workday, would register core body temperature of that person, of that worker, and it would send that measurement to that device that you see up at the right-hand corner. So this is very interesting how the project worked. We, again, in each of these 3 areas, we spent a lot of time recruiting people to recruit them to, we did outreach to recruit people for this study. So each worker would come in on a Sunday before work, and we would do baseline measurements, that weight, height, urine samples, dehydration, temperature, blood, a finger stick blood test, and also urine samples. And that would be baseline. Then they would come in the next morning, Monday morning, really early in the morning before work, and we would test all those things again. And we also did surveys with the workers to find out like what their hours, what kind of work they did, what kind of hours they did, etc. And on Monday morning, they would come in, we would give them the pill to swallow. We would again take their measurements, all the same things, measurements, do a short survey, and then fit them with the equipment. If you want to go to the next slide, you can see the equipment. And so this is the other equipment they would wear. On the top right, you can see the actigraph, and that actigraph would measure their movements throughout the day. So for example, you can see the picture up there on the left. That's a man working in ferneries, and he's bending all day long. So the actigraph would measure the amount of motion. And then on the bottom right, you see the heart rate monitor, and that would check the heart rate. And all of that information would go to, next slide, please, would go to a thing called a red cap. And so they would work the whole day, then they would come in after work, they would unload all that equipment, and that device that you saw on that previous slide would send all that information to what's called a red cap, and it would download all that information so that it could be analyzed afterwards. We also did microclimates. So we would have people take home a thermometer to measure the temperature of their home to see whether they had a chance to cool off at home in the evenings. And they also had what's called a button, a heat button that they would wear to measure their microclimates where they worked. And so we also did surveys at the end of each day to look at self-reported symptoms. And next slide, please, and we'll talk about their symptoms. So this is what we found from our study. So 53% of participants were dehydrated before they even went to work. At the end of the day, 81% of participants were dehydrated after work, 81%. Of all the people that we studied, only 10% maintained a normal core body temperature throughout the day, and 90% exceeded the 100.4 Fahrenheit limit at least 1 point during the day, and some for much longer. 42% of participants had 3 or more symptoms of heat-related illness, and that could be anything from nausea, headache, sweating. Also, some of these symptoms are also similar to pesticide exposure. And then 36% of the people that we studied had acute kidney injury on at least one day. Next slide, please. That's really important regarding acute kidney injury because day after day of acute kidney injury can lead to chronic kidney disease. We didn't study this on this particular study, but one of the things that we have been looking at since then is mental health consequences and physical health consequences of heat exposure. And that includes farm workers telling us that when it's extremely hot, they experience anxiety and depression more often. They have mood disorders, and a lot of them sometimes have psychotic disorders because of, and that sounds really horrible, it's not as bad as it sounds, but it can cause acute stress. And sometimes farm workers will, to cool off, they'll drink a beer, which is really counterproductive to trying to reduce heat stress. But all their drink caffeinated monster drinks, which also increase dehydration, but they also increase energy, so it helps them get through the workday. So again, this was talked about earlier, but they also are exposed to really harsh environments. And then they can have other just emotional stressors like financial, cultural, legal stressors, especially now with all the impacts on immigrants right now. And then they have poor access to mental health care. Next slide, please. Exacerbating factors, we didn't really look at this in this particular study, but we know, and there have been studies since then, that exposure to pesticides can be exacerbated by heat stress. There needs to be a lot more study of this, but there are at least 2 studies out there, and I think there's been more since then, that look at the fact that farm workers seem to be able to absorb increased pesticides in higher heat conditions. And again, that needs to be studied more deeply. And then we talked about earlier, Elizabeth talked about earlier about medications and heat and how certain kinds of medications can exacerbate the vulnerability to heat, and then substance abuse and lack of acclimatization. And then for mental health patients, it can be even more dangerous to be exposed to heat. And next slide. I do want to say that since we began studying this project with Emory University, and again, that was about 14 years ago, it's very obvious just how much hotter it is now. And we have farm workers tell us all the time that there's a different quality to the heat, that it's more stinging, it's more burning, it's like searing. It's almost like you're being cooked. And even though it was hot 14 years ago, when we started the study, we find that it's even more challenging now for workers. So there are special populations. Pregnant women can risk higher hospitalization, adverse health outcomes or birth outcomes, and dehydration. We've had women tell us that when it's hotter, that they feel the baby moving more often and inside them. And of course, it's more strain on them because they're doing much physical labor. And of course, that also increases mental stress from the physical pain and from just the worry about the heat. You can read that about COVID. But one thing I do want to say is we have had a lot of newspaper reporters call us over the past few years about heat stress and farm workers. And one thing that everybody's looking at real severe cases of heat, but one thing that people are not talking about is the quality of life people have. One thing that farm workers tell us is that it's not that that people are dying so much, it's that they go home after work and they feel completely drained. Women don't have the energy to get up and cook dinner. They don't have the energy to sit with their kids and help them with their homework. We had one woman tell us that she spends all weekend resting up and trying to cool off because because she's so drained and she has to get ready to go back to work on Monday. So it affects the whole family. It doesn't just affect the worker, and it affects their quality of life if they're not able to have energy to have a life outside of work. Next slide, please. And so and again, these are some of the lived experiences. So I just want to say that the Farmworker Association has spent a tremendous amount of time on this. We have done many interviews of farm workers and several videos, which we can put in the chat or share with you afterwards, of farm workers. And we've also done work with construction workers as well, because sometimes during the off season, farm workers will go in and do construction work or roofing. And off season in Florida is summertime. It's too hot to grow crops in Florida in the summertime. So can you imagine working on a roof in quote unquote off season? It's brutal. And so farm workers really risk their health and their life, both by doing farm work and doing other kinds of work during the quote unquote off season. We have done We've submitted comments and interviews to OSHA, and you can go to the next slide. I'm not going to read all of these. I'll let people, we can share these afterwards. But you can see that in this one, Natalia says that she worked in the greenhouse, and when she would complain about the heat and the humidity, the supervisor or the owner would say that the fans inside the greenhouse, because there are fans, but they are exhaust fans to pull the heat out. And the supervisor would tell them the fans are there for the plants, not for the workers. So I could talk a lot more. We are going through the ongoing process with submitting comprehensive comments to OSHA to try to get a heat standard, including many interviews of farm workers and roofers and construction workers in our area. I will say also that even though there are regulations to have water, drinking cups, and bathrooms in the fields, farm workers don't want to drink a lot of water because it makes them go to the bathroom. And the supervisor will say, well, if you go to the bathroom, then you're taking time off, and you're going to get counts against you, or the bathroom is too far away for them to walk there and get back. And so a lot of times they'll wear diapers to work, or they'll avoid drinking. And in some places, they're not allowed to bring their own water bottle into the field or the greenhouse because of concerns about contamination under the Food Quality Protection Act. So there's a lot more to this. I'm really happy to talk more. We're doing ongoing studies around farm workers and heat. We also do heat stress trainings. You can go to the next slide, please. And we have done so when we do academic research with different partners, we make sure that we don't just do it for the science, we make sure that it comes back to the community. So we developed a really intense heat stress training from this Emory study that gives the results back to the community about the study, but also talks about just the really profound impacts that exposure to heat can have. Next slide, please. And we've been doing those trainings around the state, and we're just recently have it translated into Creole. So we're doing them also with Haitian farm workers in the Immokalee area. Happy to talk a lot more, but I think my time is up, so I will pass it on, and thank you for this opportunity. Thank you. Take care.
Thank you, Jeannie, for those valuable insights. Now, I'm pleased to introduce our next speaker, Ernesto Archila, Climate and Financial Regulation Policy Director at Public Citizen. He'll be sharing where federal policy stands today and what's ahead.
Great. So I'm going to go ahead and start. So my presentation is going to focus on OSHA's heat injury and illness rulemaking, and the state of play that we currently see in the summer of 2025. Um, so first, just a quick overview of OSHA's rulemaking process in a nutshell. It's a pretty complex one, but the essential steps of it are shown here, and I'll quickly walk through them just so we understand what we're talking about. There's an early phase where we're talking about the Federal Occupational Safety and Health Administration, which sits within the U.S. Department of Labor. There's an early stage where OSHA officials and experts are engaged in early decision making. They're, making the early conversations that they have to have in the early decision points. At that point, they could request information from the public. They could publish an advanced notice of proposed rulemaking, but they're doing that to get input and develop the rule. Um, Subsequently, they would propose the rule and publish a formal notice of proposed rulemaking in the Federal Register. That's kind of a crucial milestone. I should say throughout this process, there's multiple opportunities for stakeholder engagement. There are mandated and optional opportunities to consult with advisory councils like the National Advisory Council on Safety and Health and specialized councils like the Council Focused on Construction, et cetera, and opportunities for the public to weigh in. And so once that proposed rule is published, there are comments to the rule, then the rule is refined. There's a question of potentially, if there's a challenge to whether comments were addressed, people can request public hearings. And then after the final hearings are concluded, there's a final rule that's promulgated. This slide shows you a little bit more detail. I'm not going to go into this level of detail, but this is on the OSHA website. You can see the various stages, and each one of those little boxes is, a step involved in this process. The thing I wanted to call out for attention is they have this really handy coding with these icons. And so I pulled out an example of stage two, which is developing the proposed rule. And you can see that a lot of these steps are mandated, they're required by law. Some of them are also required by executive orders, and some of them are just agency procedures. So you can see those on the left-hand side. You can see how very many of those are required by law, and get a sense of kind of the onerousness of this process. How long do OSHA rules take? So there was a GAO report that came out in 2012 that said that between 1981 and 2010, they took standards ranged from 15 months to 19 years and averaged more than 7 years to accomplish. And this is 50% longer than the EPA, 5 times as long as the SEC it takes. I pulled out one example of exposure to beryllium rule, which took 15 years, and you can see the various steps along the way there that it took before that saw the light of day. In the case of this heat injury and illness rulemaking that we're looking at today, here's a kind of a timeline. It starts on the upper left and circles around to the bottom left. The parts in blue are during the Biden administration. The red parts are during the Trump administration. And you can see that, it started with an advanced notice of proposed rulemaking back in 2021. There was a comment period through January. Then there was a virtual public meeting. Then the National Advisory Committee reviewed it, did their report. Then there's what's called the SBREFA process, which is a separate law that focuses specifically on potential impacts to small businesses. And so they have to impanel a panel of small business representatives. They go through that process. Then the construction committee approved the framework. There was a tribal representatives listening session. Finally, they come out with the notice of proposed rulemaking in August of last year. There was a comment period through January. And then we just recently got through the public hearing phase, which was June and July. And we are currently right here in this spot where we are waiting to see if this administration will proceed and issue the final rule that they should at this point, given that all the comments are in and all the experts have had a chance to say. I should say there is still, we're concluding the expanded comment period that happened after the public hearing. Right now, only people who were registered speakers for the public hearings can offer additional comments, and those are happening as we speak. So quickly, what is in this proposed rule? If we actually get the version of it that was in the proposed rule and that is being discussed, what could we expect, and what could farm workers in particular expect? Well, one, it's indoor and outdoor in scope. So we are talking about farm workers. We'd also be talking about warehouse workers and others inside workplaces that are hot. It would require a work site health and heat and injury and illness prevention plan, which has a comprehensive set of requirements around it, including identifying a heat safety coordinator that has the authority on site to ensure that the plan is implemented. It also requires an emergency response plan at the sort of firm level. It requires the identification of hazards. Um, the rule does call for acclimatization. We talked earlier about how important it is for people not to be subject to extreme heat in short time periods that their body can't cope with. And so there are two options provided in the rulemaking for acclimatization. There's the water, rest, shade, and other important controls that are triggered by certain heat triggers. And that gets me to heat triggers, which is in the rule, we have a initial heat trigger of 80 degrees and a higher heat trigger of 90 degrees. They trigger different requirements associated with some of the stuff that we're talking about. Crucially, there are paid breaks are included in the rule. And in the lower threshold, it's as sort of as needed, but they have to be provided and they have to be paid. And then above the 90-degree threshold, there would be mandatory breaks specified at time intervals. And lastly, the rule calls for effective communication with workers, training, and record keeping requirements. So there's a lot of really good stuff in this rule that really would go a long way to protect workers. I should say as well, and my colleague who's following up will get more into this, but OSHA, the way OSHA is structured, there are some states that have their own state OSHAs, and those can develop their own standards, which can be more protective than the federal one. And we have seen that happen in a couple places, and we can talk about that. So there are state protections. And then in addition to that, there's a general duty clause that OSHA can enforce that just is a blanket requirement that employers provide safe and healthy work sites. And so that's something that OSHA has used to do enforcement on existing requirements to protect workers. But not robustly enough, and we definitely need a rule to really bolster the ability of the agency to actually ensure worker protections. So where we are right now is we're waiting to see what what the agency is going to do after this comment period ends. And we have, a certain set of demands that we think are really important. We need this from OSHA urgently. Most importantly, we need a strong, specific, and timely rule. We need that rule to come out. We need it to be not watered down. We need it to have the elements that are included in the NPRM and ideally go a little bit further. And core elements that we really need are those mandatory paid breaks. We need those heat triggers. We need acclimatization, and there's a preference for that gradual exposure protocol. We need water, rest, shade, and training. Those things need to stay. And worker engagement. Crucially, we need workers to be able to give feedback and raise concerns if they don't see the prevention plans being in place. There's a couple of flags here for y'all to consider. One, Nevada recently came out with a state standard, and my colleague may speak more about it, but it is considered to be the weakest of the existing state standards. And so one of the things that we need to push back against is and something that we've seen employers start, pivoting towards is, they would like a watered down standard like the one in Nevada. And we think that that's not protective enough. So we need OSHA to go further than the Nevada standard. We need to push back against ideas that there should be a specific one for farm workers and a specific one for construction workers. We need one standard that cuts across all and that has enough variability within it to be able and flexibility within it to be able to accommodate different circumstances, which the proposed rule does. But push back against this idea that no, we need to wait and hold on and have a specific one for farms. That's just going to delay things significantly and delay life-saving help. It should not be up to the boss. So, employers and industry are pushing for more flexibility. They're saying this should be more at the local discretion. And one thing that we know is that clear standards that prescribe requirements are lifesavers and are much more effective. And so we need to hold on line on that. And lastly, we need to document what's happening. So if, there's a workplace heat injury or illness event that happens on your work site, it's important to document that, write it down, provide that information to your advocates, so that that information can be gathered up, and we can continue to build this body of evidence that this is so urgently needed. Lastly, I'll just leave you with this slide. There is a heat stress network that Public Citizen has been convening for some years. I should say, I forgot to say at the start, Public Citizen is a consumer protection and advocacy organization, and we've been in this fight on heat stress for decades. So here's the link. We can also drop that link in the chat, and that's a place you can sort of find more resources and connect. So I'll leave it there for now and happy to answer any questions.
We did have a few questions come in for you, actually, from the chat, from the question and answer here. So we've got one individual asking here, do the farm workers have any input on the rules that are going in? Are they asked for suggestions?
Yeah, I'm happy to field some of these, and if my colleagues on this panel also want to, please feel free to jump in. It looks like Jeannie wants to say something. I'll say from two things. One, there are multiple opportunities where farm workers could engage, and in fact, in the public hearings that we saw, there were a number of testimonials and stories sharing particular perspectives and events, and really, tragic stories from workers that have experienced this, in addition through their advocates, and either whether it be a union or a farm worker association or an advocacy organization, lots of groups did sort of engage and try to carry forward the perspective of workers into this process. It's certainly one that that OSHA should be listening to carefully. And Jeannie, I don't know if you wanted to compliment or correct me.
Sure. Yes. Thank you very much. And that was a great presentation. So yes, and actually that's one of the things that that our organization and other organizations are really intent upon doing, is making sure that farm workers have a voice in this. A lot of times they don't know about this. So there's outreach that our organization and other organizations are doing. But the interviews that we've done, we submit them to OSHA as public comments. Farm workers are able to do that on their own. They can also record their messages and try and send them. But yes, it's it's access to knowing about when, where, and how, and that's where grassroots farm worker organizations come in to make sure that that happens.
Thank you so much for that. We had a couple of other questions that Ginny was kind enough to answer for us in the chat. But there was one here that we're hoping to get a little feedback here. Mary asks, does OSHA only keep records of complaints for 3 years?
I apologize. I actually don't know the answer to that question. I should, but I don't. We can try and find that out and get back to you.
Absolutely. And then I know there's another question here for the link to sign up for the Heat Stress Network. We're going to go ahead and drop that link right in the chat. If you scroll up a little bit, you'll find it, but we'll drop it in a second time so you have it. And this will also be on the landing page when we publish the replay. So anybody who's here for this live webinar will also be able to access the replay. We'll send you an email when that's ready, and it will include all the links for resources like this one.
Thank you, Jubilee, for that. I want to quickly say that OSHA does have a time limit of how long the case is open for, and they also have a time frame of how long you have to actually file a report. So once there is an issue or an incident, you have a time frame in which you have to report that. Not sure what the time frame is. With Department of Labor, you have up to 2 years to report a claim, and so it might be similar with OSHA. After you open the claim, once you've established that claim, then you have 3 years they have 3 years that case is going to be open, so and remain in their file. So I hope that answers that question. And I'm glad to see so many questions coming in. Hopefully, we can answer some more of those questions after our last and final speaker. All of our speakers are well versed in this topic. So, our next speaker is Alexis Gill. She's the Vice President of Strategy and Programs with Farmworker Justice, and she's co-authored scholarly journals on this topic. So thank you so much for joining us today, Alexis.
So thank you so much for inviting me to join you today. My name is Alexis Guild. I am the Vice President of Strategy and Programs at Farmworker Justice, and we are a national nonprofit organization. We are based in Washington, D.C. We seek to empower farm workers and their families to improve their living and working conditions. We have been around since 1981, and we use a multifaceted approach. So we engage in impact litigation, policy advocacy, and capacity building and education. And so I'm going to talk briefly because I do want to have time for other questions. I'm going to talk briefly about the current federal protections outside of what's happening with OSHA, with the heat regulation, and then also just quickly what's happening on the state level. So both Ernesto and Jeannie referenced these two regulations. There are currently two protections in place that protect farm workers in some way. So Ernesto mentioned the general duty clause, and this requires employers to furnish a workplace that is free from recognized hazards that may cause or are likely to cause death or serious physical harms. Now, this is more reactive. It's extremely broad, and there is a high standard in order to be able to demonstrate that the employer neglected his duty around the general duty clause. So that is why it's more difficult to bring forth a violation specific to heat under the OSHA general duty clause. There is also the OSHA field sanitation standard, and Jeannie referenced this in her presentation. This requires employers to provide access to toilets as well as access to potable water that is suitably cool and in sufficient amounts. And so there are requirements across the country that all farms are supposed to have their workers be able to access water using single-use cups. Of course, as Jeannie mentioned, this may not always be the case. And there is also a quirk, which is that OSHA is not able to enforce its regulations on farms with 10 or fewer employees. And this is called the small farm exemption. So OSHA cannot enforce its regulations, but if there is a state plan, as Ernesto mentioned, or states can use their own funds in order to enforce regulations on small farms. But at the federal level, OSHA is not able to enforce its regulations on small farms. There is a bill in Congress called the Asuncion Valdivia Heat, Illness, Injury, and Fatality Prevention Act. This has actually been introduced a couple times, and it has recently been reintroduced this summer. It was introduced in both the House and Senate. So Congresswoman Judy Chu from California introduced it in the House. Senator Alex Padilla from California introduced it in the Senate. And it's actually named after a farm worker who died of heat stroke in 2004. And he died after picking grapes in 105-degree heat. And so this bill would require OSHA to issue a federal standard on heat stress. Now, you may be thinking, well, OSHA is currently working on a heat regulation. And as Ernesto mentioned, they are. And it is a long process, as he demonstrated. And its future right now is uncertain. So this bill is vitally important for two reasons. One, it would ensure that OSHA completes the process and that a heat regulation is implemented. But also, within 1 year of the bill's passage, it would require OSHA to put in place an emergency temporary standard. And so that means that there would be a regulation in place within a year of the bill as OSHA continues its work to finalize a regulation. So it would ensure a regulation more quickly than if OSHA on its own were to continue the process. And in the absence of federal regulations, as Ernesto mentioned, a number of states have put in place its own regulation. California was the first, and then the others that followed in the past couple years were Washington, Oregon, Colorado, Maryland, and Nevada. Minnesota has a heat standard specific to indoor environments. And then New Mexico has a proposed regulation, but it hasn't yet been implemented or finalized. And every single state has its own protections, has its own level of protections. Um, Nevada, as was mentioned, is generally seen as the weakest of the regulations. But all of these regulations do have different standards around acclimatization, around around communication and preparedness plans, and around the heat triggers. But these regulations are in place in these states. So as we think about, the states, what has been successful when we think about how do we support implementation of heat prevention policies at the state level, especially considering that at the federal level, it might take a while for action at the federal level. So what we have heard in terms of successes is enforcement data comparing incidents around heat-related injury and illness. When you look at states that have standards, the pre-standard incidents versus the post-standard incidents. And what does that enforcement and what does that data look like? How protective are these measures to prevent heat injury and illness among workers? It's vitally important to collect information, and input from workers and community-based organizations are crucial because really they are the most powerful voices because they are the ones directly impacted by these regulations. And so I will stop there for questions. And I very much appreciate being invited by the National Farm Worker Ministry to participate in this webinar.
Thank you so much, Jeannie. I'm sorry, Alexis. Thank you so much for that. And we have a couple of minutes. We're going to go ahead and answer some questions. If we do not get to your question, we will send a response via email. I think, and I do believe that Mary had a quick question about Texas. In Texas, there are no heat stress laws. Actually, it's up to the employer. Yeah, I'm in Texas.
And in Texas and Florida, and Jeannie can speak to this in Florida, in Texas and Florida, they've actually put in place regulations to prevent localities from implementing their own heat regulations. And Jeannie, I don't know if you want to say more on that for Florida specifically.
Oh, yeah. Yep. We've been trying for, I think since 2017 or 18 to try and get a heat stress standard passed in Florida. There were bills in the state legislature year after year, except for 2021. And unfortunately, they couldn't, except for 1 year of all those different years that we helped to introduce or have a bill introduced, only 1 year did it even get a hearing in a committee. And then We Count in South Florida had a big campaign in South Florida to try and get a heat stress standard locally in Miami-Dade County. And they had a tremendous campaign that lasted like 4 or 5 years. And they were on the verge of getting the Miami-Dade County to pass a heat stress standard because it's, one of the hottest states in the country. And at the last minute, the county commission postponed the vote. And in the meantime, big industry came in and lobbied the county commission, and they voted against the heat stress standard. So they ended up lobbying the state, and instead of passing a heat stress standard to protect all outdoor workers in Florida, industry was able to convince the state legislature to pass a preemption bill. So not only do we not have a heat stress standard in Florida, one of the hottest states in the country, we have a bill that preempts any state or local government from even offering training on heat stress to workers. And it is very, very harsh. And we hear from workers all the time. And if we had another couple of hours, I could share their stories with you. But it is heartbreaking to hear their stories. And it can be deadly. If you are dizzy from heat, you can end up with farm equipment, injured by farm equipment. If you're on a roof, you can fall off a roof. And that doesn't affect just one person, it affects the whole family. So we have to do better. We have to do better to protect all outdoor workers because heat is getting worse instead of better.
Yeah, thank you so much for that, Jeannie. Not to mention that OSHA right now is also experiencing budget cuts, and their workers are they're understaffed, and so it makes it extremely hard for them when there are reports that are coming in. So there's a lot of work that needs to be done. And I hope that everybody that has joined us today continues to follow this issue closely and helps us reach out to anyone who can help us pass federal regulation or help us pass these OSHA standards. There's a lot of work to be done, like I said. So thank you so much for everybody that has joined us today. I hope that that we were able to enlighten you about heat stress. And thank you to our guest speakers who did amazing, Alexis, Edgar, and Jeannie, for their knowledge on this topic and their amazing work. We will be publishing this webinar on YouTube, so it will be accessible via YouTube, and anybody who has registered will also be receiving a link so that they can follow the replay. And I also want to thank it's Marifer for being our translator today. Gracias, Marifer. Really appreciate it.